Kia ora koutou katoa. Good afternoon. First, the week ahead. I'll be in Wellington tomorrow and Wednesday for Parliament before returning to Auckland on Thursday to meet with business leaders and health and social support service providers. We'll be back in the capital on Friday and then through the weekend. New Zealand will soon move into the Covid-19 protection framework, or as it's otherwise been called, the traffic light system. This week we'll be setting out some of the key information that people, communities and businesses need to ensure that life runs as smoothly as possible once we transition. The hard truth is that Delta is here and it is not going away. And while no country today has been able to eliminate Delta completely once it's arrived, New Zealand is better positioned than most to tackle it because of our high vaccination rates and the inbuilt safety measures in the traffic light system, like the use of vaccine passes. First up, we'll provide extra guidance to help businesses prepare. Minister Wood will release a toolkit for businesses who choose to make it a requirement for their staff to be vaccinated. Already businesses like in New Zealand and the warehouse have taken this step, so this new assessment tool will help others who wish to keep their workforce and customers safe from the virus. Legislation will be introduced and passed this week to enable this framework and assist businesses. Tomorrow, we will also launch the Verifier App for businesses that require proof of a vaccine pass for entry and to operate. While a business will not be mandated to use the Verifier, it is a very handy tool. On Thursday, Ministers Little, Sepuloni and Verrill will set out the end-to-end support someone who gets COVID and those around them will receive in the community. This will include greater levels of testing, more targeted contact tracing, how healthcare in the community will work, something that already there have been initial briefings around, and what social services are available if required. The vast majority of people who get COVID in the future will experience mild to moderate symptoms that won't require hospital-level care. So what matters is that we make sure they get the best care and support they possibly can, from testing, through isolation and into recovery. Also this week, we'll be releasing detailed sector guidance so business and other organisations can see how they will operate at each level of the traffic light system. The new system is safer and simpler than the alert level framework, with business able to stay open at each level. Guidance will set out how they can operate safely to ensure that can happen. In addition to these announcements, Cabinet is aware businesses are seeking greater certainty around the date of the transition to this next stage in our response so they can prepare for reopening. As you know, we've already stated that our Cabinet meeting on November the 29th will determine which levels of the traffic light system that different parts of the country will move into, and that Auckland will move in at red. Vaccine levels will determine what level the rest of the country moves into. In order to provide further certainty, though, Cabinet has decided today that the whole country will move into the new traffic light system at 11:59 p.m. on Thursday the 2nd of December, making Friday the 3rd of December the first day that the traffic light system will be operationalised. That is 11 days from now, and it's important everyone gets prepared. You'll know that we've been long signalling that after the 29th of November meeting that it would be soon after that the country would shift. This date provides the ability for businesses in particular to now plan. The number one thing every New Zealander can do to prepare for the new system is to get vaccinated. If you're due your second shot, get it as soon as possible. Vaccine passes will operate in the traffic light system, and if you aren't fully vaccinated, you'll find you aren't able to access a range of places like bars, gyms and restaurants from December the 3rd, where proof of vaccination will be required. 83% of eligible New Zealanders are fully vaccinated, but nearly 200,000 people, or 4.6% of the eligible population, are more than 3 weeks since their first shot and will start missing out on going to places where passes are required. So to that group, I do urge you to get your second dose and download your pass as soon as possible. For all those people overdue for their second shot, got it today, New Zealand would be 88% fully vaccinated. That will make our transition so much safer. Cabinet has also decided that to ensure the transition to the new system is as smooth as possible and to iron out any issues with the use of vaccine passes in advance of the whole country moving, we will undertake a trial period by allowing hairdressers and barbers in Auckland to open from this Thursday, November the 25th, so long as they require proof of vaccination from customers. This means fully vaccinated Aucklanders can get their haircut so long as they present their My Vaccine Pass. We'll be posting and sending out detailed sector guidance, but in short, hairdressers will need to operate with vaccine passes, take bookings only, so no walk-ins. That means that we can ensure we don't have large amounts of congestion. Staff must also be fully vaccinated, and they must operate broadly as they do under Alert Level 2, which they'll be familiar with staff wearing masks and putting in place 1 metre distancing between chairs. Customers can remove their masks during their cut. Again, familiar settings to all of us from Alert Level 2. We've chosen hairdressers to trial vaccine passes because out of all of the venues still closed, they pose the lowest risk by reopening. There are fewer staff employed. Generally, numbers in the space are constrained by the number of chairs and hairdressers available, and distancing between customers can be easily maintained. I know this will offer some relief for the sector and customers. Most importantly, it offers us a decent trial of the vaccine pass in advance of that date of the 3rd of December. So far, 1.2 million people have already downloaded their vaccine pass, which is great, but I encourage everyone to grab theirs and prepare now for the movement into the new framework. As I said at the start, Delta is here, and we are now in the closing stages of preparations for the move to a new system that offers both greater protections from the virus, as well as greater certainty for business to stay open regardless of the level. I know that there will be some who may have some anxiety about these changes, but I can assure you we will continue to operate in the cautious and careful way that has served us so well right since the start of the pandemic, with our number one priority the protection of lives and livelihoods. But as will be clear from today, we're fast approaching the next phase in our COVID response that delivers more freedoms and recognises the hard work Kiwis have done to get vaccinated. It's based on the values that have served us so well, and I hope gives people the space and confidence they have the summer break that they all so deserve. We're now happy to take questions.
Minister,
Yeah, Jessica.
If we were going to move into the level 3.3 system as planned, hospitality would have been included sooner in this group. Why did you just decide to go with hairdressers and not include hospitality this week as well? 2
points. What we've demonstrated is that there is certainty now for businesses so that they will be able to reopen from the 3rd of December. In the meantime, we have made a decision to allow one group to open. That is a group where by default the numbers are smaller, more confined, allows us to safely test the vaccine pass system before we all move on the 3rd of December.
Why did you only announce the date today? Why didn't you do it last week? You said it would be 24, 48 hours. Why not give people certainty that they've been calling?
So Cabinet has made the decision today that that will be the date. That's allowed us to consider the advice from officials around just the legal requirements, gazetting, putting signing of the orders, the notice period required. So the 3rd of December is the date we can confidently move the entire country into the new COVID protection framework. And then over to you, Barry.
There's been another COVID death, a man in his 40s. Is this the youngest person in New Zealand to die from COVID?
I'd have to come back to you on the latter, but I do want to just acknowledge the death, which is obviously very sad for this person's family. This is someone who's been in hospital for a while and unfortunately has died from COVID-19, and we'll check on that, whether this is the youngest death.
COVID modeller Sean Hendy says Auckland is past its peak of COVID cases. What do you think?
What I would say is that the signs are very promising in Auckland, and on Wednesday when I join Minister Hipkins, I'm planning to show the updated figures of what the R value looks like, what the modelled number of cases, hospitalisations and ICU admissions look like. But what I can say is that you saw through last week that the hospital admissions and ICU bed numbers were not increasing. In fact, they dropped towards the end of the week, and they're hovering around 80 at the moment. This is a really good sign, and it's a reflection of the good work that Auckland has been doing by abiding by the Alert Level 3.2 rules, but also the impact of vaccination, which is quite profound. So I'll update on Wednesday about what the modelling has shown.
Prime Minister, just quickly on another topic before I boost. Would you ever back down on Three Waters?
Oh, look, we've made our decisions for all the right reasons. We cannot continue to have thousands of New Zealanders getting sick from drinking water every year. We cannot continue to have a situation where infrastructure is holding back our ability to build the houses we need. or a continuation of the situation where sewage is routinely released into our waterways. The status quo is not an option. If we maintain the status quo, ratepayers would be facing larger bills. We don't want that. That is what Three Waters is all about.
Did you ever back down on Three Waters?
No, we didn't take these decisions lightly. They've taken years of consideration, and they are designed in such a way that we retain all the things people care about: safe drinking water, the ability for locally them to be owned and managed, but us to actually turn around all of the issues we've had with water infrastructure to date.
So
Barry.
You're allowing hairdressers
Yeah.
to test the vaccination passport
Yeah.
system. You talked a couple of weeks ago about al fresco dining. You've got 25 groups in Auckland. Why not do it now? Why not allow them to do the test, or is the test for vaccine testing not up to scratch yet?
No, that would not be, that's not the rationale. Here we've got an entire sector who are able to undertake this test as a sector, and where we know that actually of all the groups that we're able to open up, this is amongst the lower risk, because the ones that we already have that have not yet reopened are all of hospitality, gyms, a wide range of close personal services. This is a sector where, by default, the number of people at any given time in a venue is going to be limited by default, where the number of workers are limited by default, and where we believe actually we can, at this earlier stage, safely test the vaccine certificates. One of the issues for hospitality and outdoor settings, one of the asks we had is whether or not we could change bylaws to enable a larger range of hospitality venues to be able to legally hold al fresco dining. We looked at that. There wasn't a simple legislative fix. It's quite a complex area of law. We haven't finished looking into those options, but it wasn't a straightforward option.
So you're saying that the restaurant sector can't test as effectively at the moment as the hairdressing sector?
No, that wasn't what I was saying. Forgive me. What I was saying was I hear the call separately that the sector has asked around us to explore enabling them to have more outdoor settings, because we've already said that they are safer than indoors. No, what I was setting out was the reason that we chose hairdressers is because of all of the current sectors unable to operate, this is probably the lowest risk one. Because, of course, then defining that only those hospitality who have outdoor settings might sound straightforward, but when you're drafting a legal order, isn't necessarily.
Are you going to, can I just ask you one more? Are you going
Barry.
to ask Stuart Nash to apologise for calling the groundswell movement racist and anti-vax?
Well, of course, look, it's for Minister Nash to explain the context of his own comments. Of course, his point was that he was referring to some of the material that he had seen in online forums, which led him to that view. I've said I wouldn't use that language, I wouldn't describe generally an entire group of people in that way, but I'm not going to ask him to apologise for his comments. He's given his context, that's his view. I take a different one.
Why don't you ask him to apologise?
I've just set out the reason.
Sorry?
I've just set out the reason. Jane?
Do you think it's acceptable that Kāinga Order is not evicting some tenants despite police call-outs, prosecutions, violence, no evictions over 3 years, and some pretty bad examples of their behaviour towards neighbours, but they are allowed to remain there?
Yeah. And look, here we have two roles that we need to take very seriously. Of course, we need to make sure that in a neighbourhood, we're doing everything we can to ensure a neighbourhood and a community is safe, that neighbours aren't duly impacted by behaviour that people would just frankly consider antisocial. The issue we also have, though, is that we are the final provider of housing in many respects. Once you're evicting someone from state housing in that way, there are very few options left.
That, should that situation override the right in some case of elderly people?
Oh, I hear you on that. And I would caveat what I'm, and as I say, I caveat that with the fact that there is a competing need for us, of course, to make sure that communities are safe, and we have a role to play there as well. As a local MP, I've come across circumstances like this, And we do have to make sure people feel safe. We do have to make sure that people are in our state housing are respecting basic expectations in a community. And, as you say, not terrorise people around them.
Change in policy though, because there's no sort of deterrent at the moment. There have been no evictions, so people are carrying on.
But
So
you
should
will,
order actually be?
yeah. That's not to say that kāinga order will not move people on into more suitable circumstances if there are issues that they identify. So I don't think it's fair to say that there are no interventions. There are interventions, and they should be utilised, particularly if they're causing, concerns in a community and people are feeling vulnerable. I'll let you finish there, Jane.
Just nice and point, the refinery up there closing down. Should or could the government have intervened to save those jobs and also to protect potentially oil prices in the future for New Zealanders?
So one of the concerns that we rightly had were twofold, just the impact on the community, and there we'll continue to do work locally with the regional economic development teams around ensuring that those high-skilled workers, that we're doing everything we can to make sure that they are utilised and retained, and supporting that work. The second concern that we had was security of supply. The advice that we've received is that these changes pose no greater risk to security of supply than what already existed with the terminal acting as a refinery. So those were some concerns we've had. Those have been worked through, but there's obviously an extra piece now we need to do alongside to support the workforce. Henry.
In hindsight, do you have any regrets about the way that you communicated and presented the level 3 step changes? Polling that DPMC commissioned for your COVID response showed that you went from really high level of compliance and understanding with the level 4 rules to widespread confusion about the level 3 step changes.
Well, of course, first of all, to point out what's really important is people understand them when we move into them. And I don't think there's any suggestion that when we've moved into those that it's been problematic. That's when we need people to really engage so they understand what's expected of them when they're there. Look, the call on us was twofold, if we can ease safely to do so, and it's not unusual all the way through. We've at least been flexible enough to step into new alert level shifts, and that's what we kept open. We signalled to people that if we were able to move, that is what it would look like, so that we could balance the need for people to plan and prepare, but also not to set an unrealistic expectation that it would be a straight move to 2.
On the traffic light system, a lot of community events that are coming up have cancelled. There's places where VAX passes won't really be workable because they're unfenced, things like school galas.
Yeah.
Are they covered by this specified outdoor community event exception? And can you set that out a bit clearly?
So across all of the traffic light framework, for the most part, if you're vaccinated, you can go about doing all the things you'd usually expect. So that's the most important thing to communicate about the new system. If you're vaccinated, you can go to hospitality, you can get your hair cut, you can go to a gym, you can go to large gatherings. What varies is just how large those gatherings are at different levels. And that's exactly the same as what we've had through our alert level system. Where we are making sure that we put out specific sector guidance is, as you can imagine, we do have to be quite particular in the way we're treating schools, because we've got large groups of unvaccinated children, we've got parents who need to supervise them. So that's an area where we will be putting out sector guidance this week that is quite particular to those venues. We'll do the same for local government, where they have events that are outdoor and where you don't have entry and exit points to check certificates.
Finally, New Zealand doesn't publish at this point the vaccination status of its COVID deaths. Most other countries do. Is there a privacy concern there, and is there any move to maybe do that, maybe more anonymised every month or something, so you couldn't, pick one person out?
The issue to date has been it's been attributable to individuals. So obviously there is a privacy issue. I'm not going to say that as the numbers increase, because we're wanting to keep our deaths to a minimum, but it is something we will look at. And we do publish every day the vaccination status of our hospital admissions, a proportion that are fully vaccinated, and also can provide that for hospital for those in ICU. And of course, we also publish every day the vaccination status of our overall cases for the day. But it's just the very small numbers with deaths.
Okay, sorry, I'll come to the core.
One of the things that would be monitored in the traffic light system would obviously also be tangihana.
Yeah.
How would you be able to man a tangihana, if they're not requiring vaccination certificates? How do you kind of keep a handle on that?
Yeah, and in the same way that we already do with gathering limits, you'll see there these options. If people don't want to use passes, then they don't have to, but they are, then the size and scale is limited. Again, we already have the use of funeral directors supporting the management of gathering limits for funeral and tangihanga. And at the same time, marae, of course, have played a role as well. So it'll be no different. There is also, there will be guidance that goes out to support, as was under the alert level system, to support marae and the choices that they will make. But we expect that marae will choose how they wish to roll out these options that they will have.
Are you concerned that there might be a backlash, like the government's trying to control how Māori are allowed to grieve for their loved ones?
No, because this is exactly why we've created a framework where there are choices. If people choose not to use vaccine certificates, then they don't have to, but the gathering limits will be lower as a result.
So can I just ask you about Auckland?
I'll just kind of scan that around. Just Barry, if you don't mind, I'm just going to come to a few people who haven't had a chance, and then I'll double back to you. But Barry, quite a few people need to go, so I just want to be fair. Yeah, Mark?
Quick question about
Barry,
Auckland.
if you just a little more patience, and then I'll double back to those on timelets, which I think include the TVs. But Mark?
Prime Minister, do you agree with the public health experts who say that as a result of opening the border on December 15, Māori will die as a result of that decision?
Well, I've of course been asked a number of times around modelling where we actually don't have that level of specificity around the impact on different groups. We do, of course, across regions, but not to that level. And I don't know how accurately models would be able to determine that. What we do know is going to make the biggest difference is vaccination rates. We know now that the area where we're making the most significant progress at the moment is with our Māori vaccination rates. And that's, of course, where a lot of people are working very hard to ensure that's the case. We're now at 79.3% for first dose. But every day and every vaccine counts as a layer of protection as we move into the new framework. But the final point I'd make is, yes, the boundary opens on that date, but we also have requirements around the movement of those individuals, and we will also be in the COVID protection framework. In those areas where there are lower vaccination rates, we'll be using vaccine passes to protect those who are unvaccinated as well. Okay, I will come. Jessica, then Barry, and then Gina.
One quick question about
Barry,
Auckland.
TVs are on deadlines as well. Jessica, and so did you. Barry, I'm going to ask for a little decorum. Jessica, and then Barry. Jessica?
Dr. Bloomfield, when we know that Auckland is going to go to red, so what's your advice around the rest of the country? Is Wellington definitely going to be orange, for example?
That's what we're working on, and my understanding is Cabinet will consider that. Of course, the public health advice is one of the inputs. Cabinet's already agreed other criteria to consider as well. What I would say is that, as you can imagine, because this is the first time we're going into this framework, and as we have in the past, and as has served us well, we will be looking at it with a very sort of precautionary lens, and with a view to thinking about where we go in might be different from where things end up. So we want to not only give good advice about where we are to start with, as particularly as the boundary opens in Auckland, but then thinking about what are the really clear criteria for moving both up and down within the framework.
You've also heard that there's a case in a Tauranga rest home. What other details can you give us about that?
I don't have any more detail about that. The only thing I can say of the 5 cases from the Bay of Plenty this morning, just one was unlinked, and the others were all known contacts, but I don't have any information about a case in a rest home.
Okay, would anyone like to take ZB's question? So, it is Jason.
Just around your trip to Auckland this week, could you just give us a little bit more information about the places that you'll be visiting?
Yeah.
You were criticised last time for not going to...
Everywhere, all at once.
Yes.
We're just finalising some of that meeting schedule. We'll put it in the media advisory a bit more detail, but what I am hoping to do in particular is, yes, connect with, again, business representatives, as I did remotely last week, but a bit of a focus for me on social service providers. I haven't had a chance to engage extensively with them in person recently, so that will be one of the one of the elements of the visit.
Just on today's decision, what does this mean for the step change level? Does this mean that Auckland will never see level 3.3, or is that still on the
It means
table?
now, plan for the COVID protection framework, you've got certainty on the date, certainty on where we're moving, and certainty that at that point we see everything reopen. So that's what we're steering everyone towards now.
To 3.3.
Yeah, we're so close to the new COVID protection framework, and that gives far more scope for reopening than the other step changes. As you recall, particularly for hospitality, they had caps on the numbers able to reopen. In many cases, I imagine it may have even been uneconomic for some. Going into the COVID protection framework gives much more certainty, and that's something they can plan for the future. We don't intend to move from that.
To clarify
Gina.
on the hairdresser trial, are beauty salons included in
It's
that?
just
and why or why
hairdressers
not?
and barbers. We've kept it quite confined. Again, because we're operating a trial here, we're able to define quite neatly who falls into that category, which is something we're required to do in order to provide the exemption for them to operate. And of course, we know that it is, of all of the things we can open, the one that we can do with a good understanding of the public health risk. A limited number of people can be in a facility at any given time by the very nature of those, by that industry. A limited number of workers, we can run booking regimes, and it gives us good feedback on the operation of vaccine certificates.
Just to follow up on
And then
Jess's
I'll come
question
back, yeah.
to Dr. Bloomfield. Looking at the stats at the moment, you've said regions that hit 90% double dosed will go into orange, but none of us look all that close. Have you got any data which suggests that we could actually get there?
Yeah, so look, vaccine levels will play a key determining factor. We've already given some very strong suggestions about what we expect. Obviously, Auckland's going into red because of the outbreak. We will not be placing any region into green, and that is because we're in a transition environment. We don't want regions yo-yoing, and starting in green is an unlikely place for people to stay while we're transitioning at the moment, particularly with boundary changes. So as for the rest of the decisions, which are made on the 29th, with a couple of days for people to then see where they will be moving. We will look at vaccine certificates, we will look at vaccine rates, we'll look at case rates, and that will be the major determining factor, but we'll also be pragmatic. So, a good indication is if you've hit 90% first dose is a good indication of where you're heading.
If all of the people who have had their first dose and are due for their second got it today, how close will we be?
Oh, well, I think at that point we end up at something like 86% double dose for New Zealand. So for many regions, they would be doing really well. But that's a strong message. 200,000 people are due their second dose. Please go out and get it. Make sure you're prepared for vaccine passes because they're coming very soon. Yeah. Anything further on that? Yeah, sorry, yes.
Just on regional travel under the RED system, some of the earlier COVID-19 information said that there'd be restrictions. So if for example, an area outside of Auckland were to be put into red, could they expect regional travel restrictions such as vaccination or...
No, regional travel restrictions, will not be the norm. Hard borders will not be the norm. There may be occasions where there are localised lockdowns, where there may be some limitation on movements, but they will not be the norm.
And just on for the hairdressing from Thursday, what sort of trials were there for the vaccination pass?
Yeah, so actually, perhaps Dr. Bloomfield could speak to this, but the team have been trialling the use of the Verifier App. I believe they did work with a small number of businesses to early on trial the use of the pass, so it has been trialled on a small scale. The trial with hairdressers and barbers in Auckland give us a much larger scale to work with, but before the whole country moves, which we thought would be valuable to the rest of the country to have that larger operation.
So just to confirm, there's been already some testing of the Verifier app, and it becomes available this week for people to, we'll announce that for people to use and get loaded up and ready to go. So we're making good progress there.
Yeah.
Issues arise from those trials?
I think small tweaks.
No, just, always just the key issue here is not so much the app, it's just how do you make it easy in operation for businesses who are doing the checking. So learning all the time.
Okay, sorry, I've got Joe, Michael, Thomas, Ben.
Just coming back to Gina's question earlier about deciding who goes into red and who goes into amber, how much of that is going to be sort of a decision at the Cabinet table for ministers, or is it a case of Dr Bloomfield and his public health team will do it on a case-by-case for each region, each state?
We will be provided with advice. Cabinet will then consider that advice and make those decisions. And then they will immediately, in essence, then be required, once we're notified, to be written into orders and gazetted. Yep.
I mean, in terms of that advice, is it sort of a, Dr Bloomfield, will you go with your team through each DHB, look at how many have got vaccinated, how many have got vaccine passes downloaded, etc., bundle all that together? Like, what level of detail are you going to be providing?
We'll provide our recommendations and some rationale for that, but we will be looking at vaccination rates. We will be looking at an equity dimension to those vaccination rates, in particular vulnerable populations in regions, as the Prime Minister said, whether there are any cases in those regions, and also health system preparedness, which we've got a big piece of work underway on as well.
Which will conclude with the orange or red per DHB, basically.
Correct.
Can I also just, last week we talked about doing some work around the next move with opening up the border early next year. Has Cabinet had an opportunity today to look at that work, and will there be decisions this week around that?
That hasn't been finalised, but I do expect that we'll have decisions shortly.
With this week likely?
I don't want to give you a specific date, but we do anticipate it'll be shortly. We do need to, again, we're wanting to constantly give as much forewarning for planning purposes as we can. We've already, of course, indicated first quarter, though, as you can recall. Yeah.
Michael, did you
Oh, sorry, I did say Michael and then Thomas, forgive me.
Thanks, Tom. Yeah, just following Anna's question around travel. I've already seen some communities ask holidaymakers to stay away, citing their vulnerable populations, vaccination rates, access to healthcare. What is your view on that? Should people be staying away from these areas over summer, and will the government be working with these communities if they want to have a localised lockdown?
Yeah, so my message would be that actually we've put in mechanisms to ensure that movement around the country can be as safe as possible. So firstly, we actually as a nation, by that time, will have very high vaccination rates. We also, as an extra layer, in communities where perhaps the resident population, the rate might be lower, we, for instance, would expect that that would be an area that would operate in red. And red means that basically if you're unvaccinated, you're unable to go to those higher risk settings. And so there are protections there. And so to anyone who has concerns, I'd say we're prepared to meet those concerns, to make sure that we've got measures that, do ensure that those who are not protected by the vaccine are protected in other ways. Yep.
If checkpoints do, start up again,
Yeah.
like it happened early in the year, what would be your...
So we do expect, of course, the police, we've already said, will work with local communities and iwi, particularly in the north, because that is an area where we expect there to be checks regardless, because that is where, of course, we will have Aucklanders potentially moving through, and they have a requirement to either be tested or vaccinated. So that is an area where we do expect there to be checks in place, and we'll continue to work with communities on that. For the rest of the country, any community there, I would again just ask that they work with their local police, because of course you do have to make sure that you're operating legally and safely with anything like that.
Thanks. Yeah, just possibly looking quite far ahead. When New Zealand does open up to international tourists, is it expected that they will need to have a My Vaccine pass to enter venues, or because they'll be mandated to have vaccines coming into the country, is there going to be a different sort of regime?
Yes, so of course we've ensured that our vaccine pass is able to be used. I know from the experience of other travellers, they've often used supplementary ways to demonstrate that they are vaccinated. We need to work through a bit more of the sector guidance, because it will be easier for them to produce their domestic vaccine pass than it will for them to log into a New Zealand process. But that's something I might just need to go away and get the official view. I know they will have thought through some of that level of detail, even if I don't have it to hand.
Dr. Bloomfield, it appears that there's been a decision to move to once-a-week saliva testing at the Auckland boundary. I'm unsure if that's the same in the border facilities. What's the reason for this? Is this being driven by science or by the strain that lab networks are under?
Always science.
Always. So yes, we sought advice from our testing group, and the main reason for this is now a high level of confidence from both our experience here and the evidence that a saliva-based PCR test is as good from a diagnostic perspective as a nasopharyngeal test. Previously, we had it twice a week, and then if someone returned a positive saliva test, they had a nasopharyngeal PCR test to confirm. But we've agreed on the basis of scientific advice that actually they can be treated similarly, which means we can go down to weekly saliva testing.
Which is what we're doing for PCR for nasal.
Why can you go to weekly?
Weekly, because that's the same as what's required, expected around a nasopharyngeal PCR.
Yeah,
so
we're not doing twice a week for nasal.
Is that the same in the border? So it's not the same in the border facilities, I take it?
It will be the same for our people working in the border facilities. That's right.
Yeah.
Yes.
Can I just ask a really quick nuts and bolts, just a Hawke's Bay related question? Sorry. Apparently the DHB there was possibly only alerted to a case in the region because a family member contacted the DHB. What do you know about this? Is it correct? Why did the Ministry of Health? Was the Ministry of Health aware of the case prior to, and why did they not alert the DHB?
Yes, so what happened is this person was tested in Auckland and then travelled from Auckland down to Hawke's Bay. When the positive test was notified by the lab and the person was notified and isolated, they were in Hawke's Bay by that time, the ongoing follow-up care was transferred to Healthline, and Healthline was making daily calls to that person. And one of the things that hadn't happened in the system, and we had a look about making sure we correct that, is they assumed the person was, I don't know if they assumed the person was still in Auckland, but we now have a flag in the system so that they will notify the local public health unit. But the daily follow-up was happening by Healthline anyway.
The DHB was kind of caught unawares. I mean, is that in those daily follow-up calls and stuff? Should they not be asked? Should it not be obvious where a person is? Yeah.
Yes, and we've had our public health units right around the country looking after people in Auckland, for example, and doing the follow-up of those cases and whānau where they've required daily sort of public health unit follow-up. So this was just something that the system should have notified the local public health unit. It didn't, and we've followed that up to make sure that the system will do that in the future.
Okay, yes, I did have you, Ben.
Sorry, you have been asked this question before, but can I ask you to be more specific around why the police aren't being mandated to get vaccinations when Andy Costa says he's up for it?
Oh, well, no, to actually be fair, all I've indicated it was just that we just haven't concluded decision-making on that yet, but I expect a decision to be communicated on that this week.
Can I also ask just about Australia is moving to quarantine-free travel systems with Japan and
South Korea, I think I saw. Yeah.